Everybody sees that, right?
So welcome. My name is Van Asher. I'm with the Puerto Rico Project. This is a mock OPS, just a sample of what one could look like. They look very different depending on where you are. Come on in. So traditionally, someone will go in, they'll clean their hands, they'll have access to injection, smoking, and inhalation materials, and then they'll go over to a room when it's free. And here we have set up for snorting. And here's a pipe. We give out pipes, and ideally there would be a smoking section, but that's set up very differently. I've been to OPSs where there's a room with a ventilation system where people could sit around and smoke. And then I've also been to ones where it's almost like a phone booth that you go into and you sit down and there's like a little tray where the phone would have been that you can prepare your substances and smoke, because they require ventilation fans in a way that this doesn't. And the most important thing when an overdose occurs is the time from incident to intervention. And we're right here. So things are very different. So there's over 105 of these in the world. There's never been a single fatality. They cut down on crime in the neighborhood. New York just came out with a study about their on-point programs on 126th Street and on 181st Street. And Sam was saying between the two programs, since the time they've been open, with the amount of EMS calls that didn't have to be made, they've saved the community $43 million.
Basically,
Good looking group.
Thank you all who participated in International Overdose Awareness Day. It will be in 2025 on that Friday, August, I think, 29th. So be looking for invites from us, but thank you. It was a wonderful event and it's going to be bigger and better next year. We have a jam-packed agenda today, so I'm going to move very quickly to our next presenters. It is West Side United. I have been fortunate to be working with this group and interacting with them for the past 6 months or so, and they're doing some amazing stuff in our community. And so they're going to tell you about their mission, their vision, and their goals on the west side, and that is goals that are very important to us, and that is reducing death on the west side of Chicago. So Veronica and LaDarius, take it away.
If we go to slide or view, or hit slideshow, right there. Right.
Sorry, my computer was freezing up. I'm sorry. Give me 1 second.
Well, right the slideshow and right next to share. See share. Then go to slideshow. Slideshow's right next to it. There you go.
All right, can you all hear me?
Say it again.
Can you hear me?
Okay, there
Yes.
you go.
Okay, I was having a little trouble with my audio right there. All right, well, good afternoon, everybody. My name is LaDarius Curtis. I'm the Senior Director of Community Engagement for Westside United. I'm joined by Veronica Pereyra, which is our Community Engagement Manager for Westside United. So we're going to talk a little bit about Westside United, as Fanya eloquently put it. Thank you, Fanya, for having us today. We've worked with Fanya on some various conversations around opioid overdose and just CVI in North Lawndale and in Garfield Park. So as you can see, Westside United, our founding hospital partners are Rush, Cook County Health, UI Health, Lurie Children's, Sinai Chicago, and Ascension. Can you go to the next slide, please? Our mission is to eliminate the life expectancy gap for Black and Brown people on the West Side. I'm going to show you the slide shortly, but Westside United has been deep rooted in the community. Most of our staff is actually born and raised on the West Side and returned to the West Side to attempt to make it a better place. We work, I would say our jurisdiction, if you will, or, our full mapping would consist of as far as Oak Park to the west, and we go as far east as about, give or take, Ashland or Halsted. And then we go as far north as about Fullerton to as far south as about 31st Street South. So depending if you're in those areas or work in all of those areas, Westside United could be a partner with you. Next slide. So as I mentioned, we are involved in eliminating the life expectancy gap. So if you are a child born in the Streeterville or Loop area, your life expectancy just by your environment alone is 80 years. If you're born on the West Side, I was born and raised in the Austin community. And even for those of you who are from the South Side, if you were to take this south to Washington, the Washington Park area, your life expectancy is 69 years. A lot of people believe that life expectancy initially was just based on DNA and genes, but what we found it is much more concerned. It's about 10 to 15% your genes, almost 20% your genes, but about 80% of your environment. So we at Westside United are looking to change that environment with the 6 anchor hospitals through education, impact investing, health and healthcare, and physical and neighborhood environment. Next slide. So this is our staff. So as you can see, our staff operations are such, our senior leadership team, myself and Veronica are in the bottom left. We have data evaluation, economic vitality, neighborhood and physical environment. And we also have a workforce development program as well that we use, specifically kind of focused in the recidivism and CVI work that we do. Next slide. So as I mentioned before, our mission is to eliminate the life expectancy gap. This is over the last, we're actually only been around for about 6 years now. So over these last 6 years, we turned 6 in June, actually. And over the last 6 years, this is some of the work that we've been doing with our partnership hospitals, along with just some of the overall strategies that we've had. So as you can see, our Accelerate is just being more involved in local procurement, small business support. We actually do a small business grant pool. We've done a small business grant pool 5 out of 6 years where we give $10,000 to small businesses on the West Side. Some of them have been startups. We've actually done we did non-for-profits before, but what we've tried to do is really focus on small entrepreneurship businesses. If anybody knows, if you're from North Lawndale, you might know Tidy Up Cleaning Services. That's one of the folks that we've given $10,000 to. We've done a few restaurants. If you're from Austin, 6978, the Soul Food Restaurant, we've given them $10,000 as well. We have a couple of other, we have actually plenty of other not only restaurants, but other businesses that we've given money to during our small business development program. We also do impact investing, where the hospital gives money for small business loans with a small interest rates on return on those loans for small businesses as well through CDFIs. So that's kind of what we do in that space. The Aligned Hospital efforts, we do a lot of work with blood pressure control.
What are you doing?
And community engagement. So we work with Boeing to pass out blood pressure cuffs to actually nurses and just people who kind of need blood pressure cuffs in general, because sometimes folks have had issues with insurance and not being able to either afford the blood pressure cuffs or just overall being too expensive to get from insurance. So we do a lot of community engagement and facility engagement with the hospitals in general. Unite the West Side is some of our, as I mentioned before, a little bit more of our catalytic investment. So we've done a few more investments. We were instrumental in the Sankofa Wellness Village. If you all saw the groundbreaking for the Sankofa Wellness Village in Garfield Park on Monday, we helped write part of the grant for the Invest Southwest through Mayor Lightfoot that helped achieve and get the money for the Sankofa Wellness Village. And then our pilot new ideas, we had actually a school hub through Herzl School that we did. We did the Herzl School elementary program where we gave away fresh produce, fruits and vegetables to pre-K through fourth grade at Herzl School, and also helped parents sign up for SNAP throughout that program as well. And we've had a few other programs that we also work with, specifically the community engagement group, which is what I lead. We're also involved in HCEZ, which is the Healthy Chicago Equity Zones, that also worked with convening for COVID response, communication, and distribution, of the vaccination process. And also we are now involved with Wellness West, which is the state-funded program that I know Bobby E. Wright was involved in, and a lot of other CBOs on the West Side are involved in, that has a CHW component. We are the community engagement agent for that program.
Yeah, we're still a part of Wellness West.
Right, and you guys, so thank you. Next slide. So the way Westside United kind of focuses and do our work is through our metrics framework. As you can see, our first tier, if you can see it on it's a little blurry I'm sure it might be a little blurry for some, but the first tier is just where we focus on the overarching goals of life expectancy. So our 5 life expectancy tiers are the cardiometabolic disease, cancer, infant mortality, homicide, and opioid overdose, which is one of the main reasons that we're here today. So when we look at our life expectancy metrics, this is kind of how we go about our work and find partners and partnerships through our work. Now, Westside United is we do not provide a service. We're not a service-based organization. We do not provide any services. When people ask me what we do, I tell them that our responsibility is to connect, convene, communicate, and capacity build organizations like yourselves to make sure that you can use your organization and your platform the best way you can. So in the long and short of it, if you will, if you're an organization that serves 20 people or 30 people, our job is to make sure that we find a way to boost your capacity to possibly get to your ability to be able to serve 40 or 50 people regularly. So that's just kind of some of the work that we do. As you can see, these are some of the healthcare outcomes that we focus on through our healthcare, our education, economic vitality, and physical and neighborhood environment. So with our, just for example, our healthy eating program, the behavior, so we kind of focus on behavior. So fruit and vegetable eating, smoking, physical activity, teen birth rate. For education, we focus on disconnected youth, high school graduation, 8th grade math, 3rd grade reading proficiency rates. So we work with all type of, whether it's CPS or even other private educational resources, to try to find out what's going on the West Side and how we can make a difference for our children, specifically in the educational sense. But in our physical and neighborhood environment space, we do have a food access and affordability work that we do. We do it through our food access department, and also through Wellness West, which Dr. Blackwell would know about. We're having our Wellness West Symposium, which is based on food insecurity and food access, October 10th, in the evening of October 10th at Garfield Park Conservatory, from 5:30 to 7:30, if you would like to attend that as well. Next slide. So I'm gonna go ahead and let Veronica take over this next slide, and then we will stay around for questions, because I did see a couple questions pop up in the chat that I will try to answer as we go through. Thank you.
Hello, everyone. It's great to be here. So some of our engagements, impact that we've had is the community grocery initiatives along with Madison and Hamlin. And these are just to bring more supermarkets that offer healthy foods in the West Side. We recently had a ribbon cutting in West Garfield Park for the Save-A-Lot. It was about like 2 weeks ago. Also the Sempoka Wellness Center that 2 days ago, we had the groundbreaking. It's going to be a hub to Westside United, to Erie Family Health, to Mayafa, just to say a few things. And also HCZ, which is Healthy Chicago Equity Zone. We are currently the West region focusing on public safety. So we're working hard with that. We're also at the table for the Garfield Park Right to Wellness Quality of Life Plan, and also engaging the policy committee with our CAC members and elected officials. We do the learning map, which is an interactive map for people to really get a sense of the West Side. We use this map with people, residents, doctors from all over the world, from partners that are from all over the US, just to get so they could really know a better feel of the West Side of Chicago. Ways that we convene is our CAC members. It's our 17-member community advisory council that represents our 10 communities. And I know LaDarius touched a little bit on Wellness West. Wellness West is a collaboration of the hospital and health systems that really utilize CHWs that are, boots on the ground to connect people with care that have adverse childcare experiences, hypertension, mental illness, depression, and substance use disorder, and just connect them with care. Also, our CAG and workforce development, we meet bi-monthly just to talk over sustainability for CHWs and workforce development. Also, our synergy sessions in our 10 communities, we do this every year. I know Fanya was in our panel discussion in North Mondale, talking about public safety. And we have one more coming up for Westtown and Humboldt Park in the upcoming months. So each one is tailored to different community needs and priority areas for each community. And lastly, our Westside annual convening, we just had one in June. And it's just a way to just celebrate our impact that we've had in the community. And I just want to share this quote. Community engagement is the heartbeat of positive change, where collective voice of the people ignite collaboration, shapes decisions, and transforms neighborhoods into an empowered and thriving spaces. And I don't know if LaDarius wants to add anything. I know I flew by that slide. Before we take any questions.
All right.
Thanks,
Very good, LaDarius. Go ahead.
No, thanks, Veronica. Appreciate that. I'll definitely take more questions. I saw one question in the chat. To answer the question, the business has to be on the West Side. kind of in those parameters to apply for the small business grant. I saw that was one of the questions in the chat, so I wanted to make sure that I followed up on that.
Does anybody else have any questions for Westside United, LaDarius or Veronica, regarding their vision, their goals for the West Side? We are intricately really involved with their work because our jobs, as all the organizations gathered here, we're here to reduce overdoses. And so when we reduce overdoses, we impact their work and then the quality of life, as well as life expectancy on the West Side expands. And that's wonderful news for me because it's kind of stark when you see the age that people die on the West Side versus, a mild difference.
I had a question, Fanya.
Yeah.
This is Pastor Epting. How are you?
I'm good. How are you, Pastor Epting?
Good, good. LaDarius, just a quick question. Is there are you guys do you guys have offices on the West Side?
Yeah, our office is actually in North Lawndale in the Nichols Tower.
Okay.
On the 7th and 8th floor, but we will be moving to the Sankofa Wellness Center once it's built. Yeah.
Okay,
so
that's what I want to know. Okay.
All right. Well, if you don't have any questions right now for LaDarius or Veronica.
I got one question. Sorry.
All right, come on in.
Actually, I want to email LaDarius and Veronica. Can you guys put your emails in the chat for me, please? That's all.
They're in the chat right now.
That's exactly what I was going to say, Dr. Blackwell. Please email them. See how you can partner with Westside United. It's important that we partner with each other, talk to each other. They are a clearinghouse, a think tank to expand capacity especially for our smaller organizations that are doing work. I see Mr. Wright, you have a question.
Yeah, my question was, when you talked about your targeted area, in regards to it, you said you only went as far as Halsted Street going east?
Austin to the west. So Austin Boulevard going.
Halsted.
Oh, Halsted. Yes, Halsted.
You said you only go as far as Halsted, correct?
Yeah. Yes.
So those people that's right outside of that area, would they be eligible for that, applying for that grant, that small business grant?
If they serve folks on the west side, throughout that portion of the west side, depending on where they are. So tell me exactly where you think they would fit.
Cabrini Green area. That's Chicago Avenue, between Chicago Avenue and Division. It's only like a small area. Right.
It's a small area. I think that we could see about that because we know how important that area is, and we know that there aren't a ton of programs in that area. Because the only one that I know about, I only know two that people use, and that's the Near North Unity program, and then what is that? Lincoln Park Community Services. Those are the only two organizations that I know of that really focus on folks in that Cabrini Green area that, other than, Chicago Recovery Alliance and folks like that. But just those two are just solely nonprofits there. I think if you put it in front of us, and we have a board that does, we have metrics and a whole criteria about where the business go to. Normally they stay inside that parameter, but there are exceptions made on all fronts. So
thank you.
You're welcome.
All right, thank you. We're going to have to wrap it up because we have another presentation that's going to talk about how to prevent overdoses and working with Black men. And that will be Samantha from the state, who is going to do a presentation regarding that. And I think you'll be interested in it, LaDarius, so please stick around.
Hi, everyone. I'm Samantha Alonis. I'm the Deputy Director for the Bureau of Prevention Services with the Illinois Department of Human Services Division of Substance Use Prevention and Recovery. We oversee substance use prevention, overdose prevention, and tobacco compliance programs. And I'm having a little deja vu right now because my last job was at Ascension, Illinois, leading health equity work. And so I actually recognize LaDarius, and good to see you again. And then I'll also be co-presenting with my colleague, Patrick Price. So Patrick, do you want to quickly introduce yourself?
Yes. Hello, everyone. I'm Patrick Price. I'm with Illinois IDHS SUPR, and I'm Prevention and Program Service Administrator working with Samantha. So thank you.
Thank you, Patrick. So what we'll be talking about today is what we're doing to identify and address overdose disparities. And this has a heavy focus on the city of Chicago. We have a project called the Illinois Prevent Drug Overdose 2, or IPDO2 project, that is specifically focused on this topic. And so what has come to a lot more people's radar recently is this article from the National Institute on Drug Abuse out of the National Institutes of Health, that older Black men are disproportionately affected by the overdose crisis. But this is something we had been looking at for quite some time, trying to drill down to understanding the disparities and where they are in different populations. So we knew for a long time the disparities were there in terms of racial disparities, but then drilling down to understand it is also significant for Black men who are 50 or older. And so thinking creatively about how do we address disparities within this population. And I know I'm probably preaching to the choir here that a lot of this content is stuff that you all probably know and could present this yourselves if you wanted to, but Fanya was kind enough to ask me to present this after seeing me present it on Monday at a different meeting. So bear with me if it's very redundant from stuff you already know. First like to talk through what the difference is between equality versus equity, since a lot of people do get this confused. But equality is where everyone gets the same, regardless if it's needed or right for them. And you see the image on the left side where the example is a curb that is not designed for a younger child or somebody in a wheelchair or a blind person. And so it's not accessible to all those people. While equity, on the other hand, the image on the right side, reflects that everyone gets what they need, understanding the barriers, circumstances, and conditions. And so you see there's actually a ramp, there's bumps on the ramp for the walking stick, there's audio, and there's lights to show when it's safe to cross. So it's accessible for everyone. And then it's better for everybody, not just the people that we made it more accessible for. And then I also like to call attention to intersectionality in these discussions, because this isn't only about race, although that is a huge part of this, and racism plays a huge role in these disparities. But drawing attention to the fact that at our core, we're all human beings worthy of respect and dignity. And it has always been important for me to call this out and help rehumanize people for those that have been historically dehumanized, especially coming from the field of healthcare and then now working in substance use prevention, recognizing how often these populations that have been historically marginalized are dehumanized as well. And acknowledging that we each have multiple intersectional identities that influence our own worldviews and how we're received by others. And our identities also influence our knowledge gaps, especially when we're part of a centered identity. And so when we're talking about these disparities, we're talking about disparities based on gender, sex, race, and age. These are older Black men. But then we also see trends of them being impacted if they have a veteran status, they were previously in the military, if they were previously incarcerated, low income. And then here's just a laundry list of other examples of identities that can influence our experiences with inequities and marginalization. And so I like to call attention to the fact if we really want to achieve health equity, we first have to focus on addressing and reducing health inequities, which are gaps that are unjust, avoidable, unnecessary, and unfair. They are produced and sustained by deeply entrenched social systems that intentionally and unintentionally prevent people from reaching their full potential. And I really like to use this example on the right to show what this looks like. So when in public health, we just focus on let's reduce a certain outcome, let's reduce deaths, or let's improve outcomes overall, when we don't focus on the disparities, often those gaps increase. And so a really good example of that is breast cancer deaths. Between 1975 and 2010, there were huge advancements to screenings and treatments in breast cancer. However, those weren't equitably accessible for Black women compared to their white counterparts. So you can actually see that the gaps widened and the breast cancer deaths for Black women increased compared to their white counterparts. But if we focus on reducing the disparities, we often have overall improvements in outcomes, plus are able to reduce that gap. We also look at this work through a trauma-informed lens, recognizing the impact of adverse childhood experiences. And so there was an original ACEs study that focused on these 10 domains, mainly focused on what happens in your household. And so you see here, it includes physical, emotional, and sexual abuse, physical and emotional neglect, household dysfunction such as mental health conditions, domestic violence, divorce, substance use, and relative who's incarcerated. And this original ACEs study recognized the impact of childhood trauma and overall health into adulthood. Now, this original ACEs study was conducted in the mid-90s with mostly white college-educated adults who were 40 and older. And even still, with that population, they found that an ACEs score of 4 or higher out of 10 led to a significantly higher likelihood of negative health and behavioral outcomes later in life, such as heart disease, diabetes, and premature death. So a quick question for the group, feel free to add to the chat. But what do you think are other causes of childhood trauma not shown here? And I'll go ahead and elaborate on some of them in a couple slides. So I'll pause for a moment.
I'm going to say loss because I used to work with juveniles. So loss is one of them.
Loss, community violence, racism, I see. Anyone else want to add?
You should include social media in that now too. They need to, and definitely need to add that in there.
Sexism. Yes to all these things. Okay, so I'm in agreement, and I'll keep going and you'll see that. But the short of it is that there have been follow-up studies that include community and systemic causes such as violence in the child's community and experiences with racism and chronic poverty, recognizing these are also childhood traumatic events. And I see housing and difference. So often when we're talking about health equity, we talk about the social determinants of health. And I put those in quotation marks because I've never really liked that term. I refer to it as systemic health inequities, because the reality is that the underpinnings of a lot of these inequities are racism and discrimination. A lot of times it was intentional to create these inequities through housing policy, education policy, et cetera. The list goes on. And so when we're talking about issues like housing, education, food security, access to health insurance, and so on, often who gets access and who doesn't is influenced by racism and discrimination, whether it's intentional or unintentional, but a lot of times it has been intentional. And all of these things influence our long-term health outcomes. If you have housing insecurity, then you're at higher risk of a whole bunch of other negative health outcomes. And so I mentioned that this original ACEs study focused really just on this first realm of ACEs. I hear some background. I think someone's unmuted. Okay, I figured out who it was and muted them. Okay, so the original ACEs study just focused on this first realm of ACEs, what's happening in your household. And these things certainly influence your experiences of having childhood trauma that sticks with you the rest of your life and causes toxic stress, influences negative health outcomes. But then we also have seen that these other community and environmental factors influence your long-term health outcomes. So that includes discrimination, systemic racism, historical trauma, violence in the community, food insecurity, poverty, the list goes on. Or environmental, you think about the pandemic was a collective trauma. And you also see environmental inequities in the city of Chicago, where like factories are built in certain communities. There's higher rates of lead poisoning, higher rates of exposure to pollution, and the list goes on. So all of these things influence our experiences with trauma, and trauma is not just a one-time event, but many people are born into traumatizing circumstances that they must then endure and survive throughout their lives. And this can include the trauma of losing a parent, caregiver, or sibling, including to an overdose, for an example. And we also have to understand the deeper historical inequities, the root causes that have led us here. And so just one of many examples to look at are housing policies that created inequities specifically for Black communities. And so you all may be more than familiar with these policies, but I'll just like provide a brief overview. But this includes like the redlining policies that were like the pre-civil rights era in the 1930s and 40s, where these banking institutions would literally map out certain communities in red as the least desirable to invest in, and then what were the areas that were most desirable. And those that were usually marked in red were predominantly Black communities, and that's why it's called redlining. And so they were purposefully disinvesting in Black communities and investing in predominantly white communities and the suburbs. And they also had predatory housing contracts. And all these things made it very hard for Black families to develop generational wealth to pass down to their families, which is not having a house is the hardest way for you to pass down generational wealth if you don't own a home. And then if you do own a home, it's one of the easiest ways to pass down generational wealth. And so this segregation wasn't an unintended consequence, it was intended, and it was public policy that influenced this. It was public policy that created this segregation, and these effects endure to the present time. And so I'm going to pass it to Patrick for the next few slides, and then we'll just keep on going.
Good afternoon, everyone. Just to piggyback off Samantha, and thank you, Samantha, for the great information. When we're talking about older Black men on the South Side and the West Side in Chicago overall, this was just a quick quote from President Nixon one of his advisors back in like 1968. We knew we couldn't make it illegal to be either against the war or Black. But by getting the public to associate the hippies with the marijuana and the Blacks with the heroin, and then criminalize both heavily, we can disrupt these communities. We can arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news, which we saw back then. I was young back then, but then as you move forward and move into the 80s with the war on drugs, with crack cocaine every night. It was on Time magazine. It was on the front of Newsweek magazine. And once you put war behind it, create agencies that can go in, everything is intentional. And once you take away a lot of things from these neighborhoods, it becomes generational. We look at the veteran population around Chicago. A lot of these veterans didn't get what they were told they were going to get after the Vietnam War, because a lot of them went straight out of high school due to the lack of jobs, and they were supposed to come back and have the GI Bill, with certain benefits that they would get, like Samantha mentioned, to start generational wealth and build up. But they kept these redline communities disenfranchised. And like LaDarius mentioned earlier, it is a lot based on environment. Can you go to the next slide, Samantha? And of course, again, this would be like preaching to the choir. But as you see, the high numbers of experience of witnessing an overdose and who are disproportionately affected by overdoses. If you look at that map from the 1940s, you move forward to this day, West Side and the South Side. And pretty much any health inequity, high blood pressure, HIV rates, congenital heart failure, issues with Black women before, during, and after birth, all of those fit. You could just layer them on top of these areas and they have not changed. Even when you move it forward, let's say to COVID, when they first opened up the site for vaccinations was at the United Center, which is in the West Loop, $1 million condos, but you have facilities on the west side and many on the south side that could have been utilized. And then it was kind of like an aha moment. I guess we can go ahead and start opening up other sites for COVID vaccinations. And also, LaDarius mentioned the life expectancy is the same on the south side. In certain areas, from east to west or north to south, there's a 10-year life expectancy difference. Can you go to the next slide, please? And as you see, like I said, from 1940 up until now, all these areas are the same. We still have a lot of work to do. And if you're 50 now or 60 now and you're an older Black man, and these are a lot of the Black men I work with in inpatient and outpatient, it is generational depression, whether knowingly or unknowingly. And when you have, trash, rats, lead, poor water, police brutality, saturation of drugs, violent crimes, teen pregnancy, generation after generation, that's very depressing. That's hard to get out of. A lot of these older guys have predisposing, conditions, either from the war or just lack of poor health. Some of them have high blood pressure, let's say cataracts, and an opioid problem. I would just ask, I'm just wondering which one you think they prioritize. Some people need surgery. They can't have it because they're avid substance users. So there is a lot of work to do. Also, I mentioned to Samantha about older Black men living in nursing homes and senior buildings. Those are often targeted by those who sell drugs. If you know what you're looking for, and you live around it, like I do, I live in South Shore, and there are a lot of nursing homes around here and senior buildings. And if you know what you're looking for, you can see it. So that's also predatory. And some of the people, I also met the older Black men and veterans, have been using outpatient methadone for 30 years, 35 years. And I've actually done outpatient methadone, and there really doesn't seem to be any, and inpatient, any, I guess, skills towards people identifying the system or systematic inequities. It's more on the individual. Here's your coping skills. Here's a list of resources. Thank you. Good luck. And I've heard from a lot of people, even getting discharged from a program is a trigger. So I think there's a lot of work that needs to be done on some of these programs that offer, they do good work, but they still need to be, I guess, checked into, see what's going on. May try to talk to some people, because a lot of these older guys just said they didn't get any help. They use substances out of boredom. They have nothing else to do, and these are things people actually told me. And a lot of them also died from overdoses, but it also, again, the bad heart, high blood pressure, heart attacks, those sort of things that predispose them to a early unfortunate death from drug use. Next slide. And some of the factors, again, using alone, living in government-assisted housing, again, which is predatory from individuals on the outside, don't use them in service programs because they're not offered in certain areas.
And I'll just add too that, like, we've heard reports that a lot of the people in Black communities, when they use substances, are smoking and snorting, and so like syringe service programs don't even reach that population, and so that's something like we have to take a closer look at too.
Adverse experiences with naloxone due to, I guess, a lot of these places need more education and ongoing outreach, not just a one-stop shop, so to speak.
Yeah, what we've seen specifically is that we've heard reports that some emergency responders will overdo using naloxone and give a traumatizing experience of naloxone administration. So people don't want naloxone after, because they've experienced like people injecting naloxone shots into them when they're already back to consciousness, which is cruel to do that. And so we've had challenges with people even wanting naloxone because of how they've been mistreated.
Inadequate access and distrust in healthcare systems. And I know we're pressed for time, but another thing that with the environment, like was mentioned earlier. There are also, you have, food deserts, you have internet deserts where basically people can't get on the internet. And also there are pharmacy deserts where there are entire zip codes, maybe more than one, that have one or no pharmacy for that service area. And it's actually a growing problem, which you can probably look up on online, but that's another issue. And again, predatory, individuals who sell substances, they go to nursing homes, they go to senior buildings. Possible having fentanyl contamination in the drug supply, correct. But these are some, but there are a lot more. And we do need to, do a lot more work, which we are going to work on. And we do want to open our arms and our emails and our ears to any sort of help you can give us, and we do want to work together and move this forward. Thank you.
And sorry for my fast clicking, but Fanya said I had 1 minute left.
Right.
So these are tips for how to apply an equity lens. You all can have this slide deck afterward. And I think you all are already doing this. It's more for other audiences that we've been trying to drive this home. And then, but I think the other quick point I want to drive home is, like, a lot of times we try to push, like, people just need to be more resilient, like Patrick was saying, like putting it on the individual and not recognizing the systems that are doing exactly what they were designed to do to keep people oppressed. And it feeds into this myth of meritocracy that anyone can pull themselves up by their own bootstraps if only they work hard enough, not really recognizing some people were shoved into quicksand and don't even have shoelaces or boots, right? And so it's really harmful to our mental health when we buy into this myth and when we struggle to overcome those adversities. So if we really want to work on addressing overdose disparities, we also have to recognize that this myth of meritocracy feeds into people feeling like they're a failure and that something's wrong with them the moment they try a substance. And if we really want to destigmatize substance use in the lock zone, we have to help people unlearn these internalized beliefs. So thank you, Fanya. I will wrap it up.
Thank you.
Thank you. Does anybody have one quick question they have for Samantha or Patrick? If not, you have their information in the chat. Please reach out to them. The truth be told, we can never hear this enough, right? Because our culture creates historical amnesia with like, we don't remember 4 years ago. It was terrible, but for some reason we're like, oh, everything was happy 4 years ago. No, so we can never hear about the history of racism, sexism, and how we got here enough so that we can combat it, so we can create solutions against how we got here. So thank you for your presentation. Really appreciate it. All right, and we'll be working together soon on something.
Hey, Fanya.
Yes.
Blue Size here.
All right.
I have one quick question. Great information. And I was looking at all of those presenting, and that's great. But I think we have been targeting and have done assessment and know this has been existing and did some things to address those issues. But there never seemed to be funding that followed what we address and where we can complete some of these targeted issues that we see. So where is the money?
State of Illinois, you know what's happening.
So I will at least share the IPDO project. That is like a separately funded project that we get funding from SAMHSA. We have providers in the city of Chicago doing this work. We're also trying to work with other partners to figure out how to address these issues, because the reality is we don't necessarily have like more funds to allocate without finding funds to allocate, right? And so we don't have an unending supply of funds, but we're trying to figure out how to get those funds directed to those community organizations who are most equipped to handle addressing these inequities.
Great, but I think if you follow the task force, we have found some ways to address those issues.
Mm-hmm. And then we just had a presentation from Westside United. They have all these hospitals together. There is something there. So I want to end our conversation because we only have 10 minutes left in our meeting, but thank you once again, and we will be talking. All right. Next up is Dr. Regina Lewis to talk about the concert in the park this Sunday.
But praise God, today was very, very informative. And I would love to talk to Samantha, not only because I am deeply rooted into the community, but this Sunday is Hope Coalition. And what Hope Coalition means is helping our people every day. And it's different organizations and coalitions that have came together to help try to reduce some of the crime in the area. The opiate task force is also a part of it, where everybody that's doing the same identical work, they get together in this committee and they go out in groups and try to help solve some of the issues in the community. The Hope was also founded by Congressman Danny Davis. He recognized about recovery. He gave all of us a second chance. And from that second chance, a lot of us have become leaders. It's going to be, I didn't tell you, this Sunday, we're going to honor the congressman. It's a surprise. Hopefully he don't hear this. And what I'm asking, every organization that he have helped funded and that he have had and passed the law with the second chance, that we show our appreciation only by a letter from your organization to him and recognizing him for all the hard work and services that he have done for the community. And with that, Sharita Nim is going to make a book for him from all of our letters. That is the greatest gift that we can give to him. So this week is about recovery. Please come out. Plenty of food, plenty of beautiful entertainment, live concert, the whole 9 yards, and it's free. Come out and celebrate your congressman, and along with Recovery Month. And thank you so much.
Thank you, Dr. Lewis. And Dr. Lewis is an amazing caterer. The food will be off the chain, so please come out, bring your family. You won't have to cook dinner, lunch or dinner on Sunday. All right, so I'm moving on to our SOS update. So we have almost completed Austin. We have a few more census tracts in lighter areas, but we're going to be covering in about 2 weeks, 2 major census tracts for Operation SOS, where there's a high percentages of overdoses. And I will be sending out emails. What I would love is for all the organizations who are online today, who have community engagement folks, to come on out with us. First, we need to train you, and then we have a bus, we put people on a bus, and then we go to those neighborhoods where, in this particular track, we need to offer a lot of services. We need to wrap around a blanket around these particular communities because they have the highest levels of overdose in Austin. So I will be sending out communications regarding this. Please get your community engagement people ready. In about 2 weeks, we're going to need their help because we're going to need all hands on deck. And we might cover these 2 neighborhoods twice because it's so important for us to reach out to these homes and these people who live in these homes, as well as the people on the streets that are around us. So we're looking for information from me regarding these 2 particular highly dense areas regarding overdose. And that is all for that. The next is, what brings you to the meeting? If anybody's new to the meeting, please unmute yourself, say your name, what organization you're with, what role, and what brings you to the meeting. Or is there anything you learned in the meeting today that you kind of want to share? So anybody new to the meeting?
Oh, hey,
Hello?
Fanya. I'm Candace. I'm joined in from CRCC. I am a peer support specialist here. And I caught the ending of the meeting, and I just wanted to just give everybody like a little update and a shout out and a reminder Saturday, September 21st is our national rally here at Chicago. I would love to see all of you guys coming out. It's one day full of fun, centering education and community awareness. We will have live music, entertainment, recovery, community sources, national speakers, and we're turning the highway of heroin into the recovery pathway 290. So I love to see you guys there.
What's
Thank
the
you.
location?
Thank you,
It's at
Candace.
the, sorry, it is at the UIC Arena, 525 South Racine, Chicago, Illinois.
And the times run from what?
The time is from 9 to 4 p.m., all day of fun.
Yes.
Thank you.
Thank you,
Thank you for
Candace.
letting me speak, Fanya.
No problem. And pop the flyer in the chat, will you? Anybody else new to the
Okay.
meeting?
I'm new. I'm Kate Lee Knoll. I'm from Lawndale Christian Health Centers. I'm the medical director of recovery services there. Kind of new to that role, so it's really great to be able to participate in this. So learning a lot today.
Welcome. All right. All right. I do not see anybody else new to the meeting. So we have the national rally this Saturday. Hope to see some of you there. And I think that is all. Does anybody else have any other member announcements?
Bobby, right?
Yes, Bobby, right.
Today we had our free coffee. We had like 20, 30 people come out. Next month, we're going to host a kind of like a free breakfast for people.
Mm-hmm.
So be on the lookout for that. And also we're going to don't hold me to this. I'm still working on it for organizations that need first aid, AED, CPR certifications. You can now come to Bobby Wright because we have 3 trainers on staff, and I am one of them. And CPI will probably be next. We're just put on the finishing touches to make sure everything can go right. So of course, if we do it, we will be offering discounted rates to our partners. So it's not a forgo, but it's more like a 75-80% is going to happen. Like I said, so we do have 3 trainers for that, and it will only be 1 trainer for CPI, but I will keep individuals posted once it happens. And you can also follow us on all social media platforms. Still trying to rebuild the Instagram page. That's going to take me a minute, so I don't really promote Instagram. But of course, we do have a Facebook page and especially LinkedIn. Please follow our LinkedIn page. Bobby Wright Comprehensive Behavioral Health Center. You should see it. You'll see our logo and everything. You'll see the pictures of the mayor and everything. So yeah, please follow us on LinkedIn and let's keep working, everybody. So, yeah.
All right. Thank you, Dr. Blackwell. Any other announcements?
Hey, Fanya, Sanel Lewis from Gateway. Happy Wednesday, everybody. It was a great meeting. So thank you, Fanya. And Lee, just wanted to remind everybody, Gateway Foundation has positions open for certified recovery support specialists, counselors, CADC counselors, nurses, as well as a psychiatrist. If anybody's interested, go to gatewayfoundation.org and check under careers. Or I put my email in the chat. You can email me directly as well.
Perfect.
Thanks,
Thank
everybody.
you. Thank you. Else. Well, we've ended the meeting right on time. Go out and enjoy the sun. Have a good day, y'all. Bye-bye.
Bye.
Thank you.
Welcome. Bye-bye.